On behalf of the Area Agency on Aging of Pasco Pinellas, I welcome you to Aging on the Suncoast. During these difficult economic times, more and more seniors are experiencing problems paying their bills. On today's show, we will review a number of resources for assistance. During the first segment of the show, we will talk with Shannon Burton, who is the Program Manager for the Area Agency on Aging's Aging and Disability Resource Center, and Natasha Martin, who is the Human Services Manager with Pasco County Human Services. Welcome to Aging on the Suncoast. Thank you for being here with us today. One of our most valuable programs that we offer to seniors in both Pasco and Pinellas County is our Emergency Home Energy Assistance to the Elderly program, which we fondly call EHEAP because those are a lot of words. Natasha, you manage that program in Pasco County for our seniors there. Tell us some about the program. What is its mission?
The mission of the EHEAP program is to assist the elderly with their electric bills when they cannot afford to pay them. It is funded through the Department of Elder Affairs, and that funding gets funneled through the Area Agency on Aging, and then they give that funding directly to us to assist the elderly with their electric bills.
Okay, so energy, heating and cooling is so very important, particularly in Florida, well, any place in the country, to keep people warm during the winter and cool, particularly in Florida during the summer. Shannon, you are the person who works with the administrative aspect of this program, so you can probably tell us what is an energy emergency. It's very important that we understand that.
Absolutely. It's a major part of the eligibility process, and a heating or a cooling emergency would be if the client had some sort of past due notice, a final notice, or a disconnection notice that lets the resident know that their electric will be shut off soon.
Okay, so the goal is to keep that shut off from happening.
Exactly.
How does one become eligible for this program, Natasha?
Well, to be considered elderly, you have to be age 60 or older. You have to be a Pasco County resident and likewise a Pinellas County resident. There is an income guideline that we have to follow. It starts at a one-person household cannot make more than $1,436 per month. Or a two-person household cannot make more than $1,938 per month. And it goes up from there based on household size.
Okay, so those are important numbers. And during this segment, we will be running the telephone number of both of the EHEAP programs, the one in Pasco and the one in Pinellas. So if people haven't caught those numbers and they want to call up to ask about eligibility and their particular circumstances, they should make a contact to ask a question. What type of assistance is available for the people who are eligible? We've mentioned electric bills.
Right, electric bills. We can also help with the purchase of gas or oil when it is used for heating. Heating only. When there is funding, we are allowed to assist the elderly with fans or blankets depending on the season, and we can also help with security deposits on their light bill.
Okay, so if someone has actually had their electricity shut off,
that's correct.
They should contact, and they're over the age of 60, meet the financial guidelines, they should contact your office. You can actually pay the deposit to get it restarted, as well as the past due amounts.
That is correct.
Okay, wow, that can make a big difference for someone
Some security deposits are very high.
Okay. Are you seeing large electric bills now?
We are seeing, for some reason, a large amount of seniors coming in with very high bills, running from $300 to $400 per month. So this is a big help to them.
Certainly. Shannon, what are the limits on assistance? How are the funds handled for this program?
Well, a person is eligible for a benefit, one per season, so once in the heating and once in the cooling, and they can get assistance up to $600 for their bill. Anything over the $600, they would need to provide some type of verification that the remainder of the bill will be paid.
Okay, so the full amount of what is past due, what is needed to keep the electricity on, or the heating source on, or the cooling source on, you're able to pay the full amount up to the $600.
Correct.
And when we talk about seasons, a heating season, a cooling season, sometimes here we don't even know when to put our summer clothes away.
Right.
So we probably need to look at a calendar and define that.
Right, exactly.
there's a period of time that is considered the heating season?
There is. The heating season runs from October through March, which would be the time you would use your heating supplies. And the cooling season is April through September, which is typically the warmer months of the year.
Okay. And are there plenty of funds available? I assume there's quite a demand for this program. How do you handle that, Natasha? Is it first come, first served?
First come, first serve. We like to do it by appointments, but we do get generally a large amount of funding each year for the elderly.
Okay, so it's important that we get this message out there so people know about it. Particularly, people are having trouble paying for food and paying their rent, and so if this is an area where we can help them, important that we make it available. How do they start the application process?
They would call one of our offices. We have an office in Dade City, and we have an office in Port Richey.
Okay.
They would call the office, let the person know that they have a shut-off notice, that they are 60 and over, and we would get them an appointment. And when they come in for the appointments, there's certain documentation that we need.
Okay.
They would need their picture ID, Social Security numbers or Social Security cards, income proof, and that shut-off notice.
Okay.
They do need to be living in the household that the light bill is in. So they might need to bring also other proof that they live in that household.
Okay.
For this program, the elderly does not have to necessarily be listed on the light bill, but they do have to be living in the household.
Okay. And if they are in a household, perhaps they're living in a household that has other people in it, you're going to need to know the income of the full household will be considered.
The whole household. So we'll need a list of everyone in the household, all their Social Security numbers. We do need to document the entire household.
Okay. I'm hearing you say shut-off notice, and I know our seniors are just so diligent about making sure that they are on top of all of their bills. If they have gotten to this point where it's so close that their electricity could be shut off, once they come in, how quickly are you able to address the situation? They, at that point, don't have weeks to wait.
Right. We do. We work really hard with the social worker's schedule to fit people in based on the date of shut-off.
Okay.
We ask them what that date is. We try to get them in as soon as possible.
Okay. And then, Shannon, once the application is received, how quickly is the assistance provided?
Well, once the application is approved, there's typically a resolution between 18 to 48 hours.
Okay, so we're talking, because this does become a crisis, we're talking about relatively immediate assistance.
Absolutely.
Tell us, Shannon, I know the program operates, well, the program is available throughout the state of Florida, as it is in other areas of the country. Tell us what is happening in Pinellas County. Is it a mirror image of the Pasco program?
It tends to be every now and then. They also have two offices, one in St. Petersburg and one in Largo. And the same process that Natasha discussed. They call the local office and they do a quick eligibility over the phone just to kind of determine if the client is eligible or not. They also let them know any kind of documentation that's needed, so that way it really helps the application process go smooth.
Excellent. And we will be running their telephone numbers along with the Pasco County offices. Natasha, I'm not sure that we mentioned where your offices are located in the county.
We have two offices, Port Richey and Dade City.
Okay.
We do offer, if needed, for people in the center of Pasco County, we do have a Land O'Lakes office where we can see someone at least once a week if needed. So we try to assist with the difficulty with transportation. Transportation's an issue. And
if transportation is an issue, people should still call and you will work it out on an individual basis to assist them.
That's correct. If needed, we can sometimes do home visits.
Okay.
If someone is homebound for a medical reason or whatever, we try to be flexible and work with the elderly.
Good, good. I know Pasco County staff is very, embraces this program because it is a way of helping the residents of Pasco County and likewise in Pinellas County. Your Department of Human Services, do you have other programs that would be able to assist seniors in the community?
Yes, we have other programs that help seniors and other age groups in the community. We have rent assistance and move-in assistance through our homeless prevention funds. Okay. And we also get sometimes other grants for electric assistance for other age groups in Pasco County.
Okay, and again, we can't get all the information out in the short time we have. They can call the numbers that we are running. So, very good. I thank both of you for the important work that you do to make this possible for our elders and others in the community, especially during these hard economic times. And I appreciate your being with us to share the information.
Thank you.
Thank you for having us.
Thank you.
Sarah is 64 and loves to garden, but recently her health insurance ran out, leaving her worried about more than just weeds. With pre-existing health conditions, Sarah's chances of finding good coverage were low. So she called the Elder Helpline and spoke with a Shine volunteer counselor. The Department of Elder Affairs Shine program provides free, unbiased counseling on health insurance for those on Medicare. More information is available about Shine or how you can volunteer at 1-800-963-5337.
During the first segment of today's show, we learned about the Emergency Home Energy Assistance Program. During this segment, our two guests will discuss how the Aging and Disability Resource Center helps those with Medicare and also those over the age of 60 to access other government assistance programs. Janet Mills, who is with us, is the area coordinator for the SHINE program, and Jason Martino is the area agency's program administrator. Janet, the SHINE Assistance Program helps persons who receive Medicare, who can be of any age. They don't necessarily have to be over the age of 60 or over the age of 65, but through SHINE volunteers are able to help Medicare beneficiaries with two important programs that provide financial assistance. And the first of those that we'll talk about is the Low Income Subsidy or Extra Help program. Tell us about that program.
That is a Medicare program to help people pay for their prescription drugs. And that is applied for through Social Security, and it is then deemed to help Medicare recipients. If you have a Part D drug plan, you must have a Part D drug plan, or you can become eligible for one if you are determined to be eligible for extra help. You can call this helpline at the Area Agency on Aging, and we have SHINE volunteers who will help you to apply for those programs.
Okay, and Part D is already assisting with prescription drug costs. This program fills in beyond that in terms of helping with the co-pays or the premiums for Part D, and we always hear about that donut hole.
Right. If you have, as a single person, an income of less than $1,439 gross, or $1,939 if you're a married couple, then you can apply for this program. There is an asset level as well, but we will work that out.
We'll call in and get the specific.
Please do call the helpline, and SHINE volunteers will help you to apply. It takes probably 3 to 4 weeks for determination. It's done electronically. We send you an exact copy of what is put in online for you, and if you even get partial extra help, then your co-pays will be lowered, your premiums will be lowered, and you will never have a donut hole, and it will make you eligible to change your Medicare program more than once a year.
So it's bringing a lot of additional benefits along with it. And I've heard you say it is a Social Security program, so they determine the eligibility. But a SHINE volunteer can actually take the application over the phone and submit it on behalf of the individual?
Absolutely.
So they don't need to come into our office. They don't need to go to a Social Security office. They just call our helpline. Our helpline will have a SHINE volunteer call them back within a few days?
Correct.
That is excellent. Is there any information that a person should have available to have that discussion with the SHINE volunteer?
Yes, they will need to know what their gross monthly income is. That would be before any deductions. What their total bank accounts are, if they have any savings or annuities or CDs or stocks or bonds, or things like that. And those types of things we need to have at the ready. Also, there's a question that asks about medical co-payments or hospital bills that they're paying off, or drug co-payments. That is all put into the mix, right?
But we would encourage our viewers not to put off that call. Make a call into the helpline, start the conversation, and we can help them through the process.
Yes, we're there to help.
Wonderful. And another important program that, again, Shine volunteers assist with is the Medicare Savings Program, or we call it locally the Medicaid Buy-In Program. Tell us what that assists with.
There are 3 levels to that program, and the highest of which can both pay for your Medicare Part B, which is $104.90 this year, or if you're at the highest level, it could even pay the other 20% of your health care that original Medicare doesn't pay. If you are qualified for the 2 lower levels, you will still have the opportunity to have the state pay for your Medicare Part B premium,
which again is this $104.
Right.
So people who are having difficulty putting food on the table, or paying for their prescription drugs, or paying their rent, if they could be eligible for this program, it could save them a lot of income per month that they can use for other things. That is wonderful. And how do the Shine volunteers help with that program? That program is administered by the Department of Children and Families, isn't it?
Right. And we don't work for Department of Children and Families, so we do a 3-page paper application for them, fill it out with them, and then just mail it to them for their signature with a pre-addressed envelope to then mail for processing. And DCF has 45 days to process that application after they receive it. Okay.
So again, the determination is made by the organization that administers the program, but Shine is providing wonderful assistance. We're talking about these being volunteers. Share with our audience the qualifications of the volunteers, because these are complicated programs, and we want to know how are the volunteers prepared to handle this. And
we are Shine volunteers, which is an acronym, serving the health insurance needs of elders, and we receive extensive training, which is ongoing all the time. We have a background check, and we are there. There is always someone available as a Shine volunteer to call you back, hopefully within 1 to 3 business days, to help you with whatever you may have called in for help, including the LIS and the MSP program.
Okay, and these volunteers, this program is a national program, and it is funded by Medicare, by CMS. It's been in operation for 20 years. In the state of Florida, it is administered by the Department of Elder Affairs. So it's a very structured program, and the volunteers are well prepared to provide this valuable assistance. Jason, we want to talk some about another financial assistance program. This is a program that we're able to assist those who are age 60 and over, applying for SNAP, or what used to be known as food stamps.
Correct.
What is the Area Agency on Aging role in regard to SNAP?
Well, first, I really appreciate you inviting me today, because this is a good opportunity for me to talk about this program here. And maybe I should back up a little bit and just give you a little bit of history of the SNAP program. And we use a lot of acronyms, so I'm going to spell it out for a little while, and then I'll go back to the acronym. So, the USDA, which is the United States Department of Agriculture, had a program that they've had in existence for roughly 40 to 60 years, and it was called the Food Stamps Program. Now, the Food Stamps Program has been known around the country to have a certain stigma to it, and what they've understood is that not a lot of people would apply for those benefits. So they rebranded that, and they called it the SNAP program. And SNAP means Supplemental Nutrition Assistance Program. Okay. That program is offered nationwide, and it serves families and individuals who are food insecure, or those that can't afford to purchase those food items to better their well-being. And so the United States Department of Agriculture, the USDA, they contract in the state of Florida with the Department of Children and Families, which is what we call DCF. But because the Department of Elder Affairs, what I call DOEA, has an interest in serving seniors within the state of Florida, they were able to apply for and receive a pilot program. And that pilot program is called the SNAP pilot program, but it's unique because it's offered and administered in a different way than the Department of Children and Families offers their services.
And tell us what door this pilot program has opened up for those who are over the age of 60 in Pasco and Pinellas. What are you able to do through this pilot?
A lot of different things. This pilot program was offered to 5 different planning and service areas, and our what we call our PSA is one of them. So we serve Pinellas County and Pasco County. What we do is the normal operation for the Department of Children and Family is that an individual would have to go to one of their service sites, or what they call an access site, and or they can apply for SNAP benefits over the computer. But what we do know is that a lot of seniors don't have access to some of the sites. Transportation is a hard thing for them to acquire, and we also know that there's a lot of seniors out there that don't have computer proficiency. So the uniqueness of this program is that they can call our Aging and Disability Resource Center, and they can make an appointment to talk to one of our SNAP operators, and that SNAP operator will take that application over the phone. The other beauty of this piece of it too is that they don't have to sign any forms. The only way that they attest to everything that they're saying is true or correct is that they do what we call a telephonic signature. So that application is taken in roughly around 30 minutes or so. It's forwarded on to the Department of Children and Families, who does the eligibility determination of that, and that process has been done. So we were able to really serve a good amount of people that are homebound and or don't have access to different service sites and don't have computer literacy.
Oh, wonderful. So you actually have a person who's walking them through this application process without them leaving their home. That is excellent to know. And for both of these programs, we will be running the helpline number, and that is the point of access for anyone who is interested in the program.
Right.
Both of these programs are available in Pasco and Pinellas County and do not require any fee for service. It's assistance that is our mission, to get out there and assist.
Absolutely.
Is there specific information that applicants will need to have in order to start this process?
Yes, yes, that's a good point. When they call the helpline and they make that appointment, a SNAP operator will call them back as soon as possible. And what that SNAP operator will generally ask them is to come up with some documentation so they can start to speak to that over the phone. And some of the documents that we would hope consumers would put together to make the application process an expedited one or one of ease is that they should show a couple different things. There should be documentation in there or some information showing the composite of the family structure, if there's multiple individuals living in the household or if there's just one. And other documentation to show or illustrate the financial picture of what's going on in that family. So that could exist of bank statements. It could consist of what it costs to pay their rent and or their mortgage. And then another big thing that that's necessary is the state has they want an understanding of the different types of medical expenses that consumers in our community need to spend, and having a good picture or an understanding of what types of medical expenses you have makes the process go a lot more smoother.
Okay, but again, as with the low-income subsidy and the Medicare Savings Program, start the conversation by calling our helpline, and we can walk through the gathering of these documents and information if that assistance is. We can't physically help them, but we can tell them what is needed if they need some guidance there.
Absolutely.
I recognize, today we've been discussing valuable programs that we want to get that information out to the community, but we would ask any of our viewers who are elders or Medicare beneficiaries, if they are having financial difficulties, to call our helpline, and there are perhaps other resources in the community or that can be offered through our agency that we can put them in touch with to meet their financial needs. Certainly that is our role to assist. We have a few minutes left, Janet, and I would like to give you some time to tell us other things that the SHINE program does beyond the financial assistance program, because it's such a wonderful and needed program.
We do serve people who are on Medicare, who can be people who are on Social Security disability, who have Medicare and are well below the age of 60. We help with Medicaid, informational problems, billing problems, long-term care considerations. changing Medicare plans or choosing Medicare plans when they're first available. Every year there is the annual enrollment period, and we serve a huge service there in helping people to see if there's a better means of getting their health care for the next year, because everybody can change every year or more, depending on whether they're getting government help. And so we serve a myriad of
you
things.
answer most any question regarding Medicare, the use of Medicare benefits, and I know our area of the country is going to be undergoing changes in how durable medical equipment is paid for, so we may find some residents who have questions about how they're getting their oxygen or their mail-order diabetic supplies, or if they receive a notice about any change in that, Shine can assist them, walk them through that process. It's so important to recognize that the Shine volunteers are unbiased sources of information.
It's an education advocacy program. No one in the Shine program should ever tell anybody what to do. But we should be patient and help someone to come to their own best conclusions. We're not selling anything. It's education advocacy.
And I have to take this opportunity to congratulate the Shine volunteers. We have a core of 40 to 50 volunteers at any given time. Many of them have been volunteering for over 5 years and are just a wealth of information. But our Shine volunteers have been recognized for 2 years in a row as the best group of volunteers in the state of Florida, based upon the quantity of information that they are able to provide. But we also, in the area agency, see the quality of that information, and we're so proud of it. We would invite, I assume you were looking for volunteers at any time, of people who like to learn and would like to help in this process?
Right. As you can see, it is a very special volunteer program, but people come to the program to give. You need to be a learner. You need to have a working computer in your home. You need to be available for the learning experiences, and we would welcome applications by calling the helpline.
Very good. Very good. Thank you both for sharing information about your important programs with our audience. I hope that you as an audience have found this helpful, and if you have a need for additional information, please call our toll-free helpline and we will be there to assist you.
James is 70 and a writer whose joint pain has been a story in itself. His doctor prescribed a new medication that may not be affordable, even with James's Medicare Part D plan. James called Shine. Shine volunteer counselors can guide you to money-saving prescription assistance programs, including a program that helps pay Medicare Part D plan costs for limited-income seniors. Shine costs nothing but could save you time and money. More information is available at 1-800-963-5337. Soon it will be time to make important decisions about your Medicare prescription drug coverage. The Florida Department of Elder Affairs Shine program can provide free, unbiased guidance in selecting a Medicare Part D or Medicare Advantage plan. If you have questions or need help, Shine can guide you through the enrollment period ending December 31st. More information is available about Shine at 1-800-96-ELDER. That's 1-800-963-5337, or on the web at floridashine.org.